Lung transplantation is a life-saving procedure performed on individuals with end-stage lung disease when other treatment options have been exhausted. It offers hope and the potential for improved quality of life for patients facing severe lung conditions. Here are some important points about lung transplantation. Candidate evaluation. Patients undergo a thorough evaluation process to determine their eligibility for lung transplantation. This evaluation assesses the severity of the lung disease, overall health, and suitability for the procedure. Factors considered include lung function, medical history, age, and other organ function. Waiting for a donor. Once approved for transplantation, patients are placed on a waiting list for suitable donor lungs. The allocation of donor organs is based on various factors, including the severity of the patient's condition, blood type compatibility, body size, and geographic location. Importance of support systems. Lung transplantation is a complex procedure that requires a strong support system. Patients often rely on the support of family, friends, and healthcare providers throughout the transplant process, including pre-transplant evaluation, the waiting period, and post-transplant recovery. Surgical procedure. Lung transplantation involves the removal of the diseased lungs and replacing them with healthy donor lungs. The surgical procedure can take several hours and requires a skilled surgical team. The new lungs are carefully connected to the recipient's blood vessels and airways. Post-transplant recovery. Following the transplant, patients require intensive care and close monitoring in the hospital. Immunosuppressive medications are administered to prevent the body from rejecting the new lungs. Recovery and rehabilitation involve a multidisciplinary approach, including physical therapy, pulmonary rehabilitation, and regular follow-up appointments. Potential complications. Lung transplantation carries risks and potential complications, including organ rejection, infection, complications from immunosuppressive medications, and the development of other health issues. Regular medical surveillance and adherence to medication regimens are vital to minimize these risks. Long-term care and lifestyle changes. Post-transplant, patients need to commit to long-term care, including frequent medical checkups, lung function tests, and ongoing management of medications. Lifestyle changes such as adopting a healthy diet, avoiding tobacco smoke, and practicing good hygiene are crucial to maintain the health of the transplanted lungs. Quality of life improvements. Lung transplantation can significantly improve the quality of life for patients with end-stage lung disease. It can relieve symptoms, increase exercise capacity, and allow individuals to engage in activities they were previously unable to enjoy. However, it is important to manage expectations and understand that recovery and outcomes vary for each individual. Emotional and psychological support. Lung transplantation is a life-changing experience that can bring about various emotional and psychological challenges. Patients and their support systems may benefit from counseling, support groups, and psychological support to navigate the emotional aspects of the transplant journey. Lifelong follow-up. Lung transplantation is not a cure for the underlying lung disease but a treatment option that requires lifelong follow-up and care. Regular monitoring and ongoing communication with the transplant team are essential for long-term success. Lung transplantation provides hope for patients with end-stage lung disease, offering the potential for improved lung function, quality of life, and extended survival. However, it is a complex procedure that requires a multidisciplinary approach, careful patient selection, and ongoing medical management to optimize outcomes. Organ shortage and waiting time. The demand for donor lungs far exceeds the supply, resulting in a shortage of available organs. As a result, patients often face a significant waiting period before receiving a transplant. During this time, their condition is closely monitored, and adjustments to treatment plans may be made to manage symptoms and optimize health. Donor suitability. Finding a suitable donor match is a critical factor in the success of lung transplantation. Factors such as blood type, tissue compatibility, and size matching between the donor and recipient play a crucial role in determining the compatibility and viability of the transplant. Double lung and single lung transplants. Lung transplantation can involve either a double lung transplant, where both lungs are replaced, or a single lung transplant, where only one lung is replaced. The choice depends on the specific condition of the recipient and the recommendations of the transplant team. Rehabilitation and physical therapy. Following a lung transplant, patients undergo a comprehensive rehabilitation program to regain strength, endurance, and lung function. Physical therapy and pulmonary rehabilitation help optimize lung capacity, enhance respiratory muscle strength, and improve overall physical well-being. Transplant medications. After a lung transplant, patients are prescribed a lifelong regimen of immunosuppressive medications to prevent organ rejection. These medications suppress the immune system, reducing the risk of rejection but also increasing the susceptibility to infections. Adherence to the medication schedule and regular monitoring of drug levels are crucial for maintaining the health of the transplanted lungs. Post-transplant monitoring. Patients who have undergone lung transplantation require regular follow-up visits with the transplant team to monitor lung function, medication effectiveness, and overall health. Frequent lung function tests, imaging studies, and laboratory tests are conducted to evaluate the function and well-being of the transplanted lungs. Possible complications. While lung transplantation can greatly improve quality of life, there are potential complications that can arise. These may include organ rejection, infection, side effects from immunosuppressive medications, and the development of other health issues. Early detection, prompt intervention, and close collaboration with the transplant team are vital in managing and mitigating these complications. Long-term survival. The long-term survival rates after lung transplantation have improved over the years. However, the overall success and prognosis can vary depending on several factors, including the underlying lung disease, the recipient's overall health, adherence to treatment plans, and the occurrence of complications. Regular medical care, lifestyle modifications, and adherence to medication regimens are crucial for long-term survival and well-being.